గ్రూప్లో జాయిన్ కాకపోయినా గ్రూప్లో పెట్టారా వాట్సాప్ గ్రూప్లో వీటిలో పెట్టిన క్లాస్ సీకా సాస్ చేయమని అరే నీ దగ్గర కూడా ఏంది అట్లా మాట్లాడతారు మెల్లగా మాట్లాడతారు అర్థం కాలేదు కానీ అంటే ఇక్కడ నేను చేస్తాను కదా అక్కడ ఎక్సెప్ట్ చేయను ఫస్ట్ నాదే కదా నాగరాజు మీ పేరు లేదు కదా
अरे साउंड खुद सर ये निकल
तो स्टार्ट करना है
स्टार्ट कर दो हो गया क्या करोगे
कर दो
खत्म मैं जाना चाहता हूँ
Good morning to all the students. Am I audible?
Yes, sir, you are audible.
Good morning, sir.
Good morning, very good morning, students. So, welcome to this webinar on Down syndrome. So, we all know that October was the awareness month of Down syndrome. So, we are conducting a small webinar on Down syndrome. So, this webinar will be followed by, after me, this webinar will be followed by Mr. Suraj discussing etiology and intervention strategy for children with Down syndrome, and Mr. Suraj will deliver his knowledge on vocational training. So before starting this webinar, I would like to show you one video. So just have a look on this video. Are you able to see my screen?
Yes, sir. Yes, sir.
Yes, sir.
So now have a look to this video.
Video is not audible, sir.
Yes, sir, it is not audible, so.
It has no background. It has only a background music. Just read the caption.
Okay, sir, okay.
See how beautiful that video was. Yeah. So this is so incredible. See that video was so incredible. You see that the kids are so beautiful and that little treasures still the soul. So it is heartening to see that the people are learning to encourage them to include in the mainstream society, and it is appreciate to that the charm of these who have Down syndrome, they are including in the mainstream society. So so this to another this is to the session. So I will cover about Down syndrome, what is Down syndrome, types of Down syndrome. So I will share my PPT. Is it visible?
Yes, sir.
Yes, sir.
Okay. So we are going to start this session. What is the Down syndrome? Okay. So see, we all know that human body is made up of cells. Okay. So all cells has a center. That center is called nucleus. In nucleus, our genetic material is stored. Okay. So this stored material that we called as a genes. Okay. So as we know that these genes are very important to carry some codes. Like these codes are very responsible for all our inherited characteristics. Okay, so like physical characteristics, behavioral characteristics. Okay, so these are the some characteristics which we inherited from our parents in the form of genes. Okay, so on the other hand, in the nucleus, the nucleus is so see in the on the other hand in nucleus there is a DNA molecule. Okay, that is packed like a thread shaped structure that we called as a chromosome. Okay, so in normally the nucleus of each cell contains 23 pairs of chromosome. Okay, so that means in normal human body we have only 46 chromosomes. Okay, so but in individual with Down syndrome they have 47 chromosomes, not 46 chromosomes. Okay, so this extra genetic material in the form of additional genes, this result into Down syndrome. Okay, so Down syndrome we can say it is a chromosomal condition that cause nigh to serious physical and developmental problem. Okay, so in this, children with Down syndrome are born with an extra chromosome. Okay, see, typically what happens, a child is born with 46 chromosomes. Okay, so but in case children with Down syndrome, they have an extra copy of one of these chromosomes, and that chromosome is 21st chromosome. Okay, so if the child gets this extra chromosome, then it results into a Down syndrome. So for this extra copy of Down syndrome, we have a medical term which we called as a trisomy. Okay, trisomy 21. So trisomy 21 we can formally say Down syndrome. Okay. So this extra copy of chromosome affects the development of the body, child, brain. Okay. So which can cause mental, physical challenges for the children. This is historical background of Down syndrome. See, this Down syndrome was first discovered by Dr. John Langdon Down. Okay, in 1866. He was a British physician. In 1866, he published his work. He wrote a paper, and the title of that paper was "Observation on the Ethnic Classification of Idiots." Okay, so his work was an accurate description of person with Down syndrome. After his work, he was known as father of syndrome, and before his work, Down syndrome, he was see Down syndrome. Before his work, the children with Down syndrome was known as Mongoloids, or we can Mongolism. Okay, so because their physical feature was looked like a Mongolia people. So, but now the use of this word Mongoloid has been stopped because it shows racist. Because of this Mongoloid word, there were so many cases. Okay, so now we called it as a Down syndrome. Now we will see the types of Down syndrome. See, according to National Down Syndrome Society, there are three types of Down syndrome. Okay, so the main, and in this type of syndrome, the main thing is that we often can't tell the difference between each type of Down syndrome without looking at the chromosomes. Okay, because these three types of Down syndrome have same physical and behavior features, and they have same physical and facial characteristics. Okay, so only by the help of chromosome we can differentiate these three types. Okay, so the first type is trisomy 21, and the second is translocation, and the last one is mosaic. See, in trisomy 21, see, in Down syndrome, 95% cases we have found this type of Down syndrome. Okay, so that's why we called it as trisomy 21, and we consider it as Down syndrome. Okay, so this we have already discussed in first slide. So again, here in trisomy 21 means there is an extra copy of chromosome. Okay, chromosome 21, 21st chromosome in every cell. Okay, there is an extra copy. So this is the most common form of Down syndrome. See, this is usually caused by an error in cell division. Okay, see, at the time of conception, a pair of 21st chromosome in either the sperm or in the egg. Okay, so it fails to separate. When it fails, then the embryo will develop with an extra chromosome. Okay, so this is trisomy, where the child born with extra copy of 21st chromosome. Okay, usually we have only one pair of trisomy 21, but with children with Down syndrome, they have extra copy of 21st chromosome. Okay, now next one is mosaic. See, in this type of Down syndrome, there is a mixture of two types of cells. Okay, some from 46 chromosome and some from 47 chromosome. Okay, so and this mosaic, this is the least common form of Down syndrome. Only I think only 1% of all cases we have seen of Down syndrome. Okay, so children who have mosaic Down syndrome, they may have very few characteristics we can see in the child, like in physical or facial characteristics. Okay, so and last one is translocation. This type of Down syndrome covers only 4% of all cases of Down syndrome. Okay, so translocation Down syndrome is a type of Down syndrome when one chromosome breaks off and it attaches to another chromosome. Okay, so in this total number of chromosome in the cells, remain 46. But in this additional or in this we can say like additional full or partial, that copy of 21 chromosome attached to another 14th chromosome. Okay, so the presence of extra full or partial 21st chromosome can cause the characteristics of Down syndrome. Okay, now we will see the feature of Down syndrome. Most children with Down syndrome share at least some physical or facial characteristics. Okay, so by these characteristics, we can differentiate or we can distinguish them from individuals with normal chromosome complement. Okay, so in this type of children, they may have a small head, or their head somewhat flat at the back side compared to normal children. Okay, they may also have short nose, short neck. They may also have large tongue. Okay, that may be visible from mouth and sticks out of the mouth. Okay, their eye shape will be like moon shaped eye, or that is different from typical eye. Okay, almond shaped eye we can say. So they may have a small and flat nose. They may have a small feet, and in the feet they have a larger space between big and second toes. Okay, than the normal space between the big and second toe. So, and normally see, in normally we have two fists in our palm of each hand. Okay, so but in case of children with Down syndrome, they may have only one crease on their palm of each hand. So, and they have inward curve and short fingers also. Okay. So these are the some physical and facial characteristics by which we can differentiate the children with Down syndrome. Okay. So, and see, apart from this physical and facial features, they have other features like we can say they have some associated health problems. Okay, so in this we can include like heart disease, gastrointestinal problems, cognitive impairment, dental problem, vision problem. Okay, so and thyroid condition also. So see, some kids with Down syndrome have no health problem. Okay, so but some other may experience of these kind of health problem. Okay, some may experience medical issues. Like for example, about half of our children with Down syndrome are born with heart defect. Okay, so because this heart defect present at the time of birth, so this defect is called congenital heart disease. Okay, so in this situation, if the child faces some minor heart defect, then it can be prevented by medicine. Okay, in serious heart defect, they may need surgical treatment. But not every child with a heart disorder will need surgery or medicine. Many children can lead full lives despite of heart disorder. Okay, some kids may also face gastrointestinal problems. Like in this children with Down syndrome, they may face problem like vomiting, diarrhea, constipation, and abdominal pain. Okay, so approximately like 3% of child with Down syndrome are born with improper opening of anus. Okay, so because of this improper opening of anus, they are not able to pass their stool. Okay, so this can be easily identified by the doctor when they examine. Okay, so so by the simple surgery, it can be corrected. Okay, so and most children with Down syndrome, they may have mild to moderate cognitive impairment. So due to their low intellectual functioning or due to their cognitive impairment, they may face problems related to their memory. They may have short attention span. Uh, they have poor judgment, slow learning. Okay, they may face delay language and speech development also. So likewise, children with Down syndrome, they may face problems related to their gums also. Okay, so like for example, children with Down syndrome may develop teeth more slowly than other children. Okay, they may develop teeth in different order, or they may develop fewer teeth only, or they may have misaligned teeth if we compare to children who do not have Down syndrome. Okay, so likewise, this type of children, they may have faced some hearing or vision problem also. Okay, so like see, as we know that we observed in previous slide that these children have abnormal ears. Okay, so sometimes the hearing loss may be related to their structural problem with the ear. Okay, so they face vision related problem also. In this we can include like cataract. Okay, which can be presented at the time of birth, or in this we can also include like cross eye, near or far brightness, okay, so involuntary eye movement. So by the proper managing technique, we can handle this type of problem that is related to vision or hearing. Okay. So again, they like children with Down syndrome, they face problems related to their thyroid. Okay. So see, this thyroid gland is very important to produce a number of different hormones. Okay. So children with Down syndrome may face hypo and hyperthyroid. Okay. So see, in this case, in Down syndrome case, hyperthyroid is less common. We see more hyperthyroid in case with children with Down syndrome. Okay. So in hypothyroid, we can see like they may face problem with dry hair, weight gain, slow pulse, constipation. Okay. So abnormal periods, rough skin. Likewise in a hyperthyroid, they may face problems related to their weight loss, uh, change in behavior or diarrhea. Okay. Uh, Swelling of the thyroid gland. Okay. So thinning hair, bulging eyes. So all these problems we can see if they face thyroid problem. Okay. See, now learning abilities. Okay. See, first we have to understand that children with Down syndrome experience learning difficulties. Okay, as we all know that we just now we discussed these type of children face some cognitive impairment. Okay, so they may have intellectual disability ranging from mild to moderate. Okay, so these learning difficulties or these due to their low intellectual functioning, uh, this can lead to delay in many other areas of life. Okay, like in personal, social, academic. Okay, but however, not all areas of development are affected equally. Okay, but if we compare with normal children, then children with Down syndrome usually learn and progress more slowly. Okay, so if we want to teach anything, if so in order to teach anything, it is important to consider and recognize their learning profile, okay, learning abilities, so that the teacher can use most appropriate strategy for the children with Down syndrome. Okay. So see, if the teacher are using most appropriate strategy with children with Down syndrome, then in this case, the children with Down syndrome are able to develop their knowledge. They can learn new skills. Okay. So, so by teaching anything, we have to consider learning profiles. Okay, in learning profiles, we can include their strength, their weakness. Okay, so like for example, these children are very good in socialization. Okay, so so in this case, in this case, we can make them to learn by engaging them in like peer groups, or we may also incorporate by learning by doing method or by or playway method. Okay, so we can use this method by teaching the children with Down syndrome. Okay, so like see for another example, like children with Down syndrome generally take longer to learn new things. Okay, so in this situation, if we want to teach new skills, then new skills may need to be broken down into smaller steps so that they can learn step by step. Okay. So and some children with Down syndrome are good in visual learning. Okay, so in this situation, we may give concrete things, pictorial things, or any practical material we can give. Okay, so that they can learn effectively. So likewise, we have to consider their learning abilities or learning profile if we want to make them to learn. Okay, so we have to consider their learning abilities. Now see, there are so many myths related to their Down syndrome. Okay, see, first myth is Down syndrome is contagious. Okay, so this is only a myth. Okay, some people think this can be spread by touching, but now we have learned that this is Down syndrome is only a chromosomal disorder. Okay, so Down syndrome is not a disease or is not a illness. It is a condition. It is a chromosomal disorder. Okay, it's when someone is born with an extra copy of uh, 21st chromosome. Okay, in their DNA, either in full or partial. Okay, so so with this they have some cognitive impairment also. Okay, they have health related problem also like cardiac, gastrointestinal abnormalities. Okay, so this is not a contagious disease; it is a chromosomal disorder. Now, person with Down syndrome have a short lifespan. See, uh, Again, this is also only a myth. Now we have advanced medical facility, advanced technology. Okay, so now it is clear that their expectancy has reached 25 years to 60 years. Okay, and some living beyond 60 and even 70. Now, persons with Down syndrome all look the same. So, see, it is true that there are some features that people with Down syndrome may have in common. Okay, like for example, like their eye, face shape. Okay, but like in any group of people, there is a huge variation. Okay, for some people, one feature might be too prominent. Okay, but for others, they may not have it at all. Okay, so people with Down syndrome look like members of their family, like all people. Okay, so and person with Down syndrome cannot read and write. See, and the answer is that they can read and they can write. But many people with Down syndrome have the capability to read and learn to read. Okay, just like any other child when they begin their school. So see, but in this, the important thing is to identify the best method of teaching each child. Okay, so all people with Down syndrome can learn and can develop and can achieve their goals. So people with Down syndrome have developmental differences. Okay, so we need to consider their differences. That after we can decide which method is suitable for them. Okay, so it is important to identify best method. See, person with Down syndrome have a severe cognitive disability. See, as we already discussed, most people with Down syndrome have a mild to moderate cognitive disability, okay, or we can say intellectual disability. But uh, their low cognitive functioning does not limit their potential. Okay, they may longer to learn anything, but they can learn and they can develop. Likewise, person with Down syndrome cannot achieve life goals. See, with the right support, they can learn. Okay, they can achieve the goal. Some of if we go through with the Google, then we can see that some children with Down syndrome, some people with Down syndrome, have got their PhD degree. So with the right support, they can achieve their goal. Okay, so I stop here. So I conclude this session. Like so, today we have learned about Down syndrome. Okay, so when the child gets extra copy of chromosome, then it will result into Down syndrome. Okay, so in this we have three type of Down syndrome. First is trisomy 21, where the child have one more extra copy of 21st chromosome. Okay, so in second type of Down syndrome is mosaic. So in this there is a mixture of two chromosomes, some from 46th chromosome and some from 47th chromosome, and the last one is translocation. Okay, so in this 21st chromosome attached to 14th chromosome in either full or partial form. Okay, so apart from these, the children with Down syndrome shows some facial and physical features and characteristics like short nose, moon-shaped eye, almond-shaped eye. Okay, tongue is visual, short face or short fingers. They may have other medical condition also. They may face congenital heart disease. They may face gastrointestinal problems. Okay, so they may face hearing and vision problems. They may also face problems related to thyroid and lungs related problem also. So, most children may face mild to moderate cognitive or intellectual disability. Okay, so this can be result into delayed development, or they may take long to learn anything. But by the proper intervention, we can make them to independent, and uh, they can lead to meaningful life. Okay, so that's all I have for today's session about Down syndrome. So now I'm going to hand over this session to next speaker, Mr. Jitendra Singh, who is going to deliver his knowledge about intervention and etiology. Okay, thank you so much. Now Bhupender will take next session.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Yeah, good morning to all. Can you hear me?
Morning,
Good
sir.
morning, sir. Yes, we can hear
Good
you.
morning, sir.
I think I'm audible to you.
Yes, yes, sir.
Yeah, okay. As Dr. has introduced that that last month was the Down syndrome awareness. On top of that, we are just going to like awareness where we can learn that what are the different symptoms they have and what are the different strategies we have for children with or people with Down syndrome and what we can provide them. So I'm just going to share my slide here. So where we will discuss about the interventions and etiology. I think you can see the screen.
Yes, sir, we can.
Yes, sir.
Yes, sir.
Okay. So here we are just going to discuss about the etiology and the interventions for of Down syndrome. So as Gauri Shankar also has discussed about the introduction, that basic concept of Down syndrome. So I'm not going to be in a deep in that. So the simple is that Down syndrome is a genetic conditions which cause mild to serious physical and developmental problems. And most of the cases with Down syndrome is happen because of our chromosome abnormality, where the chromosome 21, because of 21, when the proper distributions not happen or extra copies comes in the place, so because of that, that things lead to Down syndrome. So here the person or the pupils with Down syndrome born with extra chromosome, that is our P21 chromosome. As we all know that uh, everyone have the 23 pairs of chromosome, where half chromosomes comes from mother and half chromosomes comes from father. So if in that case, if something happen, some like abnormalities happen, some copies are there of that P21 chromosome, so that is going to make the persons with Down syndrome, that is going to lead the Down syndrome. So already you have seen all those features. Gauri Shankar had discussed about this. So directly we'll go with etiology because we have shortage of time. So here we can see that abnormal cell division involving chromosome 21. So when there is any abnormality in the division of chromosome 21, that is going to lead the Down syndrome. And when they have extra genetic material which is responsible for the characteristics feature of the development problem of Down syndrome. And as Gauri Shankar has discussed about three types of Down syndrome, so these three types are also a cause, because here we can see that trisomy 21, that is our P21 chromosome. So in the case of Down syndrome, 95% cases are because of trisomy 21 only. And mosaic Down syndrome, it's a actually rare from Down syndrome, where the cell has this extra copy of chromosome 21. If, for example, that if the 21 chromosome 21 having copies, so that means the chromosome 21s are going to be a three pair, sorry, three piece. That means one is from father, one is from mother, and one additional copy is going to be there. And that additional copy, that extra copy, is going to lead Down syndrome. Then translocations of Down syndrome, in that what happen, when the chromosome become attached with other chromosome before or at the time of conceptions, so that is going to lead Down syndrome. And there is not a specific cause or etiology for behavior and environmental factor of Down syndrome. So that means basically it's a because of chromosome only. The major etiology and the major cause of Down syndrome is the abnormality of our chromosome. If that chromosome is going to make a pair and extra copy, and if there is an extra chromosome, so obviously that is going to lead the Down syndrome. And that is the main most important question here, that it is it inherited. So no, uh, it's not inherited because it's caused by mistake because of the our chromosomal abnormality. So that can happen if the person is not having Down syndrome. If the both parents are not Down syndrome, but there is chance that child will become Down syndrome because of that chromosomal abnormality. So it's happened because of translocations of the chromosome, and 3 to 4% of children with Down syndrome have the translocations, and some of them are inherited from them. And when translocation are inherited, the mother or father has some rearranged genetic material from chromosome 21 on other another chromosome, but extra genetic material, but no extra genetic material. For example, if the father is having uh, proper copies of the chromosome, means he's having 23 pairs only, and the same thing is having mother. But when they are going to pass of those chromosome to the child, okay, during the conceiving, so obviously if there's any translocations or if there's any extra copy, so that is going to be a going to lead and going to be a cause of the Down syndrome. And it can pass an unbalanced translocations on the children. So that is the cause, and it's not inherited also. When we talks about intervention, so we have to see that what is the main motto of to provide the intervention. Whenever we talks about interventions, before that we have to go for deep diagnosis and observation, because every child has individual capacity, individual limitation. So once we develop any kind of intervention, that is going to be a person to person, that is going to be a individual to individual, because every child has their own unique ability. So on the basis of their ability, on the basis of the area where they are lacking, for that we have to develop the intervention. For that we have to go with the proper observation and deep assessment. So once we got the proper assessment, so on the base of that report we have to provide the intervention. And in the case of Down syndrome, there is not a particular treatment, there is not a specific treatment for Down syndrome, but there are wide range of physical therapies and developmental therapies which can help them to overcome, to survive, to perform their day-to-day tasks. And most of the children with Down syndrome, they are having physical, occupational, speech therapy issues, speech issues, and educational issues, and they may have little socializations issue. They may not participate in social gathering, social activities. They may have little lack of communication, and sometimes they may feel that they don't want to be a part of that communication or discussions. So for that there are few things which can need them to overcome from all such things, that is our physical therapy, occupational therapy, speech therapy, educational service, and social recreational activities we can plan for them. And we can offer, we can program, we can plan the job training skill, which is more important, because vocational training is the most important part for children with special need. If they are having like Down syndrome, ASD, intellectual disability, whatever conditions they have, we have to provide a vocational training for them. So here we'll go with the intervention like sensory integration. So in sensory integration, first of all, we have to see the learning. When we start the learning, this all depends on our sensory coordination. like our sound, our touch, our taste. Yeah. So if we are not able to see the things, so obviously we may have little problem to perceive the knowledge. We will not get the proper stimulation. If we are not getting the proper stimulation, then obviously we will not able to produce, we will not able to respond to that particular stimulation. For that, our sensory integration, sensory coordination need to be there. And children with Down syndrome may have issues in the coordination of the senses. When they have issues in that coordination, so for that we have to provide them proper sensory integration therapy, which can help them to perceive the knowledge, perceive the stimulations, and they can work on that. They can give the response on the basis of our stimulations. There's different senses like visual senses, olfactory, gustatory, vestibular, auditory, and our tactile sense and our proprioception sense. Or almost we used to talk about our sight, smell, taste, hearing, touch, but we used to forget about the balance and body awareness. That is our vestibular sense and proprioception. And in the case of children with special need like Down syndrome, children with ASD, children with intellectual disability, they have majorly difficulty, major issues in the proprioception and vestibular sense. So for that, we have to provide them proper intervention plan, proper sensory integration therapy. And when they have little senses issues, that may lead hyper responsive behavior and hypo responsive behavior. For example, if the child is not able to get the proper stimulation, he may show some kind of abnormal behavior, like he may scream, he will throw object, he will get hyper. So it's because he's not able to understand the things, he's not getting that proper stimulation. So we may feel that he's overreacting, but that is not overreacting in their situations. They are not able to perceive that proper stimulation. Because of that, they are showing such kind of behavior. So for that, we have to observe them very carefully, so which will help us people to plan a proper and a better effective intervention plan. So in hyper responsive behavior, they they have overreactions. Means we feel that they are overreacting. Why? Because we used to give the proper stimulation continuously, we used to give the stimulation, and if that stimulation is in a huge amount, if we are giving multiple information at the same time, they were not able to perceive that. So because of that, they may show some kind of overreaction, that is hyper responsive behavior. And the same opposite is hyper responsive behavior. When they are not getting the proper stimulation, they are not getting the proper information, they fail to register that input. So for that, sometimes we used to see that children with the Down syndrome, they used to, if they are touching some kind of material, some stuff, so continuously they used to touch that particular things to get the proper stimulation, because they fail to register that input in their brain. So for that, they are just trying, they used to try to explore that things so they can understand that. That is hyper responsive behavior. And these both kind of behavior develop because of their poor sensory coordination. Next, most important part is our mental health and emotional well-being. In that case, the major role is our counselor and our psychologist. So where the children or persons with Down syndrome may withdraw themselves, may not copy the skills, they may reduce the copying skill, they may have difficulties communicating, and they may not able to solve different kind of problem, they may show some kind of anxiety, and compulsive behavior and depression. For that, proper management plan need to be developed. So we can see in depressions, they may show sadness, severe social withdrawal, and avoidance of activity. They may not able to participate. They may feel that, yeah, these are the things which are overloaded on me. I'm not able to overcome with that. I'm not able to participate in that. So when the person develops such kind of thoughts in their mind, so obviously that is going to develop the depressions. So in that case, we have to provide the proper counseling for them, and they may include withdrawal from social and physical activity. They may not participate in physical activity in social gathering, and in that case, we have to provide variety of treatment options for them. Counseling, we have to identify the coping method for stressful events. We have to give the medications, and we have to make them to participate in different kind of activities, and we have to involve them in exercise. Anxiety, they may show the anxiety, restless behavior, panic behavior, excessive worry about the things, because they used to follow a particular schedule. They are not that much social, and if they have some kind of schedule, they don't want to make any kind of change in that. So if we are going to introduce some kind of concept, some different stimulation, if we are going to give them, so that should not give at the same time in a bunch. It should be in a part, and in the initially period, initially is, we have to introduce a different multiple skills, multiple stimulation we need to provide. So later when the child is in learning phase, so they may not feel that, yeah, this is something which is new for me. So if the child is introduced with all such things, so they will behave in a normal way. And compulsive behavior they have to show because of routine only. They have tendency to follow the familiar routine only. They may appear repetitive or compulsive behavior. So when we are introducing some kind of physical activity, social activity, we have to introduce in a early life only. So when we introduce such things in early life, so obviously that will be their schedule, that will be their daily routine only. So when the things, the skill, the activities are a part of our daily routine, we may not have any problem to follow that and to continue the things, and that is not going to make any kind of behavioral change in ourselves. So we have to introduce all the things initially stage only. And hyperactivity may appear very easily. They will get distracted, impulsive, and restless, and they may have little difficulty to maintain the attention on task. Obviously, when the child is in learning or in a particular setup, particular environment, and we are giving them to perform some kind of task, some kind of skills, and if they are getting distracted, if they are having impulsiveness, so they used to fail to give the proper attention on that particular task, and there may be a cause barrier to participate in physical activity. Obviously, if the child is not able to give the attention, so obviously he may not give the same attention to participate in physical activity, and in that case medication can help it out. So here it will help them to participate in activities, and the child will enjoy and increase to an activity that provides an calming effect. Medications can help it out. And physiotherapy management, as you have seen the characteristics of Down syndrome, they have varieties of physical abnormality. So when it's about physical abnormality, we have to provide the physiotherapy. So the major role of physiotherapy is to correct the movement through the help of exercise. So in physiotherapy, we are not going to use any kind of medicine. That is mostly based on the exercise only, where it used to function on our gross motor functions. And here, if the child is having like walking issues, he may not able to walk properly, he may have shoulder issues, he may not able to move his arm, and if he's having any associate conditions, so in that case physiotherapy can help them to independent and to perform their task without any support independently. And down syndrome, typically they have combination of sensory integration therapy, neurodevelopmental treatment, and perceptual motor therapy and conditioning program. And there are some kind of issues which will address physiotherapy, that is developmental delay milestone, balancing issues, and reduce level of physical activity, issue with sensation, and mental health and emotional well-being, and high chance of Alzheimer disease. Actually, that Alzheimer disease is related to our sleeping disorder. So here in Alzheimer, what happens? The child is not having insomniac, but he may not able to get the proper sleep. So in that, physiotherapy can help in that case, because in physiotherapy they are using different kind of exercise. So when the child is involved in exercise, so obviously he may feel little tiredness, and his body will feel to take some rest, and which will lead and which will help them to get the proper sleep. For that, physical exercise is a most important part to help out in the Alzheimer disease. And neurodevelopmental treatment, actually neurodevelopment treatment, it is introduced by physiotherapy only, physiotherapist only. In that, what happened in neurodevelopmental treatment, they are using exercise to make the child function. But here their more focus is on to develop the quality of movement and coordinations between the individual muscle. So it will help to develop the coordination in the muscle. For example, neck and shoulder, if the child is having little issue in neck movement or in shoulder movement, so in that case neurodevelopmental treatment can help in that case. And it is more effective when we introduce, when we plan, when we implement the neurodevelopmental treatment in a early intervention phase. Because in a early stage, what happens, once we have learned some kind of pattern, that is very difficult to change the pattern. For example, if we have developed wrong walking pattern, like tiptoe walking, so when we have developed the tiptoe walking, that is little difficult to change that, it will take a huge time. But if we have introduced neurodevelopmental treatment in a early stage, in an early phase, so that can help out very rapidly. So we can see the changes very fast in the children with special need or in children with Down syndrome. So these are the some different kind of intervention which can help for children with Down syndrome or people with Down syndrome. And mostly in the children with Down syndrome, our more focus need to give the physical physiotherapy and behavior therapies, because they may have little segregations, they may feel like we are not a actual part of the society. So that is going to make them to develop the anxiety and other emotional disorder in. So for that, we have to provide the proper counseling for them. So where we, and the more important thing is we have to make them feel that they are a part of this society. So to develop the inclusion and to be to make them a part of the inclusion, part of the society, proper counseling need to be provided. And when you judge someone based on a diagnosis, you miss out on their abilities, beauty, and uniqueness. Because we used to see the children with the certification, with the diagnose. We used to forget that these are all human beings. So as a professional, as a part of society, we have to develop, we have to promote the inclusion. So they are a part of the society, and we have to provide the opportunity to them. We have to make them to participate in a social activity, in a communication and initiative. We have to do that, and whatever is required, whatever intervention they require, is our responsibility to plan that and to provide that. So I'm just going to stop here. Thank you. And now I will like to request Mr. Suraj sir to continue this.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Okay, thank you, Mr.
Mr.
Bhupender.
I have
I
seen,
have
and
seen, and
as
as
rightly you
rightly you
said, that
said, that
occasional
occasional
training is
training
very
is very
important
important
for
for
children with
children with
any
any
disability, any
disability, any
developmental
developmental
disability,
disability,
whether it is
whether it is
Down
Down
syndrome
syndrome
or
or
autism
autism
spectrum
spectrum
disorder
disorder
or
or
intellectual
intellectual
disability or any
disability or
other
any other
disability. The
disability. The
process
process
remains the
remains the
same.
same.
Okay, so
Okay, so
before I
before I
move
move
to
to
vocational
occasional
training and
training
make you
and make you
understand
understand
how to
how to
prepare,
prepare
um, the
the
children with
children
Down
with Down
syndrome
syndrome
or
or
developmental delay
developmental delay
in occasional
occasional
training,
training,
we need to
we need to
understand a
understand a
concept of
concept of
occasional
occasional
rehabilitation,
rehabilitation,
because
because
that's
that's
very
very
important.
important.
Okay,
Okay,
now
now occasional rehabilitation,
occasional
occasional
rehabilitation.
rehabilitation.
Let us
Let us
understand first
understand
what is
first what is
habilitation.
habilitation.
Habilitation
Habilitation
is
is
your
your
a
a
process through
process
which a
through which a
person
person
born with a
born with a
certain
certain
impairment,
impairment,
which are
which are
helped to
helped to
channelize their
channelize their
residential
residential
capacity
capacity
to their
to their
maximum
maximum
development,
development,
so that
so that
he or
he
she
or
could
she could
live a
live a
normal
normal
life
life
in the
in the
society
society
as much
as
as
much as
possible.
possible.
That is a
That is a
meaning of
meaning of
habilitation.
habilitation.
And
And
rehabilitation,
rehabilitation,
as name
as name
indicate re,
indicate
if
re,
I
if I
add a
add
re
a re
here, it
here, it
becomes a
becomes a
rehabilitation.
rehabilitation.
In
In
rehabilitation,
rehabilitation,
see,
see,
it
it
is
is
the
the
combined and
combined and
coordinated
coordinated
use of
use of
your
your
medical.
medical.
You
You
combine here
combine here
medical,
medical,
you
you
combine your
combine your
social
social
skills,
skills,
you
you
combine your
combine your
educational
educational
skills,
skills,
and
and
then you
then you
combine
combine
your
your
vocational
vocational
training.
training.
Okay,
Okay,
so
so
rehabilitation means it
rehabilitation
is
means
the
it is the
combination of
combination of
different
different
skills
skills
which
which
which will
which will
help the
help the
children
children
with
with
adult
adult
or with
with
autism
autism
or
or
Down
Down
syndrome or
syndrome
any
or
other
any other
to
to
live
live
independent in the
independent in the
society.
society.
Highest
Highest
possible
possible
level of
level of
functioning
functioning
abilities.
abilities.
It is
It is
nothing but a
nothing but a
restoration of
restoration of
handicap
handicap
condition.
condition.
If the
If the
person
person
has
has
born with
born
some
with some
handicap
handicap
condition,
condition,
how we
how
can
we can
channelize
channelize
those
those
conditions to
conditions to
make
make
them
them
independent
independent
in the
in the
community,
community,
in the
in the
society.
society.
Okay,
Okay,
see,
see,
this
this
vocational
vocational
rehabilitation
rehabilitation
works on
works
the
on the
ecological
ecological
approach.
approach.
Ecological
Ecological
approach.
approach.
Now, what
Now,
is this
what is this
ecological approach?
ecological approach?
Ecological
Ecological
approach
approach
is
is
about
about
your
your
community,
community,
the
the
stages of the
stages of the
community.
community.
Okay,
Okay,
so
so
I'm not
I'm
going
not
to
going
go
to
in
go in
detail. I'm
detail.
just
I'm
going to
just
give
going
you
to
the
give you the
concept of
concept of
occasional
occasional
rehabilitation and
rehabilitation and
occasional
occasional
training.
training.
So,
So,
in
in
occasional
occasional
rehabilitation,
rehabilitation,
when we
when we
add
add
occasional
occasional
training,
training,
when we
when we
add
add occasional
occasional training, it
training, it
might be
might be
any
any
job
job
or
or
trade.
trade. which you select for children with developmental delay, children with Down syndrome, autism spectrum disorder, or intellectual disability. Okay, so as I mentioned earlier, rehabilitation is a combination of your different skills. Occasional training is another skills which is combined to make the child rehabilitate. Okay, so when I add occasional, it become occasional rehabilitation. That means we are doing occasional rehabilitation for children with intellectual disability, autism, and Down syndrome, or any other disability. So this is the short concept of occasional rehabilitation. Anyways, in coming while ago, we are going to discuss about the occasional phases of or training. Okay, so what are the different phases of occasional training? But before we move to occasional phases, we need to understand the transition model, because this is the model which is used almost all over the country. Without the transition model, we cannot understand what are the different stages or how to prepare them. So that we need to understand, and after that we will see a short vocational assessment, a functional assessment, which is very important before you give a vocational training. So there's three factors, or these three things we are going to see. Okay, now let me share the transition model. Just hold on, I'll share. Are you able to see? Just respond me with S. Yeah.
Yes, sir.
Yes, sir, we can see.
So this is a transition model which is used by all over the country in special schools. Now, before you prepare, you need to understand this transition model. As you can see, school instructions, that means a functional curriculum. You would have aware about FACT, that is your functional assessment checklist program. So that curriculum is taught. It's not only FACT, there are different other curriculum which is specially designed during those stages. So during the school instructions, the child are trained in almost all the domains of it might be a personal, it might be a social skills, it might be academic skills, pre-occasional skills, recreational skills. So which is very important during that stage. Once it is done, then they are going to shift to the occasional. That means in special school or during the school instruction till 17 years they will be getting those services, and once they finish their schooling instruction they will be moved to the occasional training. And when they come to the occasional training, you can see they will undergo with the occasional assessment. Once the occasional assessment is completed, we are going to identify a job, we are going to do a job analysis, job matching, and then we are going to train, and then at last we are going to place them. Where we can do the placement is like, it can be in the companies, or it can be, or any other, as I said in the beginning, ecological approach in the neighbor, whatever based on the assessment initially which we have selected. So it can be a open employment, it can be a group employment, it can be a self supported. Okay, self employment, we can train the child to open his own business. Group employment, it can be with the partnership, with the with the grouping base. And open, like how we are working, the child will be moving on his own and coming back to the home. Supported, it might be, there must be some supervisor to guide them all over the day. Okay, so job placements are in a different mode. So based on the child, based on the adult person's need, skills, we are going to place them. Okay, once the placement is done, it is we haven't finished our job. We need to do follow up. We need to do ongoing. We need to support them. That is your ongoing support services, so that we understand the child retain his job, what are the difficulty he is facing, whether he has any difficulty at the job site. So all these things we need to follow up. Okay, so this is a transition model which we need to understand. Okay, this is how we need to prepare the children by keeping his aim in our mind. Okay, as per the assessment. So after this, let us understand the vocational assessment. Let me share that also. Vocational. Yeah. So vocational assessment. Once once the child is completed the school instruction, we need to move them to the occasional training. So what we do when the child comes to the occasional department, what we have to do. Now occasional assessment, the main thing is occasional assessment. Now occasional assessment, as you can see this flow chart, you're going to do that particular adult person. That means occasional training you're going to provide only after 18 years. So you're going to assess the training. That means that particular person with Down syndrome, with intellectual disability, or any other developmental disability. Opposite to that, you need to do the community assessment as well. Because until unless the training skills and the job skill match, he or she may not be satisfied, or he may not be comfortable with that particular job. Let us say the child has this skill and you have given the skill job which is not matching at all. That means the child may not able to coordinate in his future. That's why we need to do a trainee assessment as well as the community assessment. Okay, so I will just show you the assessment part of trainees, because it's very huge. But anyways, I'll tell you in the brief about the community assessment. See how we do a community assessment. We go to the job site, we go to the in the community. We identify a job by keeping in our mind as I have that boy whose skills can match here. Let us say, for example, if I'm going to a petrol pump here in Secunderabad. If I see there is a job, let us say, filling tire, air. So whether the skills the child has or not, the person has or not, then I'm going to analyze the job. Okay, what are the skills required to for this that particular job. I'm going to match that job to my client. Okay, I'm going to train. I'm going to train all work behavior related skills. What is work behavior related skills? Work behavior related skill is like the child must go to the job site at the right time. He must behave properly. He must sign the register. He must talk to the people properly. These are all work behavior, which is very important at the job site. Okay, so that is your community assessment. Again, for community assessment, we have a different checklist. We have a different checklist for the work behavior as well. We're not going to go in detail, but this is what we do in the community assessment. Now, when we come to the other side, in a trainee assessment, we have to find out whether my client, whether my person or child is ready to work or not. That is our target. This is what we need to identify first. Okay, and once this is done, once both the skills are matching, then straight away we are going to place the child. It can be in any mode. It might be a supported employment, open employment, sheltered employment, or self-employment. Okay, so it can be in any mode, and after that you need to do the follow-up. Okay, so that is what we have to do in the vocational department. So as I said, let me show you the vocational assessment, because this is the functional assessment which we have to do when the child comes to you. Okay, now as you can see, this is the profile in any checklist you will see, but here the difference is in the it is in the point number 9, which we are going to discuss. Let us have a brief look of vocational profile here. Identification data, it's like same, what is the name and all demographic data you're going to write down. The pedigree chart tells you the prediction, whether has any condition previously, socio-economic status of parent, whether they live. Okay, and this generic skill which you are looking at, this we need to fill at the end of your assessment, because this profile you give when you go for the at the job site and asking the job for your client. Okay, and then you will say my client has good personal skills, communication skills, social behavior, functional academics. Okay, it is like a resume which you're going to prepare at the end for your client. Okay, then associated condition, this is very important. Like you need to understand your child's handicap condition, because why? Because you require some adaptation. Let us say a Down syndrome with some sort of associated condition of hearing impaired. So what kind of adaptation you are going to do? You want a hearing aid. If he has a physically handicap, you're going to do some sort of physical accommodation adaptation for that particular child. Then only you can train the vocational or some trade to them. Okay, so that's why it is very important to understand whether the child or person adult person has some associated condition or not. And then training covered. See, whom you are assessing right now, whether he has received some training in different department or different school or somewhere else, because that will give you the base to train the particular person. Okay, the daily routine. See, here the daily routine is important to understand whether he maintains the punctuality, whether he has. This will help you to train the child in work behavior skills. Work behavior skills. As name indicate itself, what are the behavior required when you are placing the particular person at the job, at the work site. Okay, he has to go on time. He has to punch it at particular time. He has to sign the register. He has to take the lunch. Okay, he has to, what will be the snack time. So everything we need to understand. We need to write down appositely. Then experience in the employment. Now this is what we are looking for. Now you're going to assess whether your client has some experience in domestic work, because In the job side, he has to eat, he has to do his domestic activities, other personal activities, which is very important. And 8.2, if employed bear, what type of work or salary he has drawn, that is also very important. If you are assessing the child a first time, he is just 18, he has never worked, just put it best, it is not required. But there will be certain condition where, the person is migrated from Delhi to Hyderabad, Hyderabad to Delhi. So in that condition, he might be trained in some school. So in that case, that data is very important. And then possibility of employment. Now, see here, this number 9 has an important role in training, preparing the children with training. See, in what type of employment the family member involved. If the family member has involved in the grocery businesses, or he has a stationery shop, or he is working in the gardening, so does the child has an interest? Does the child can involve in his family business or not? So that is very important to understand. Then potential employment opportunities in neighborhood. If I train the child, if I train the person, whether you have certain, okay, if the parent says, okay, in my neighbor I have a grocery shop which I can ask and I can request them and I can get a job. So my focus will be teaching the particular person to get trained in that particular area, okay, because I have seen. So in that way also we can match, and we can train the adult person with Down syndrome or any other associated condition. Then possibility of self-employment. Some parents say, no, we don't have money to hold the self-employment. In that cases, even we can give the occasional guidance, okay, that you may get some fund from NHFDC, that is National Council for Handicap Condition. From there you can get with a 0% interest or some, as per the norms, okay. So in certain condition we can guide. Now what type of work the trainee wants to do? See here, it's not only the parents' interest, but the person's interest also. Parents says, yes, I have a grocery shop in my neighbor, but child is not interested. Child is interested in doing an office boy work. So totally it is changed. So that's why when we come down, I will tell you the reason what we have to do in certain conditions. So what type of support the parent expect for their son and daughter? So what type of support they expect? That also is very important to find out. And what type of support the parent expect for the employment for their son and daughter. So these questions you need to verify, you need to justify, and you need to write, and then you need to start or plan your training. Okay. Now here, Number 10, areas in which a guidance is required. Now, as I said, occasional guidance or occasional training or mobilization. You have to pick in which area the parent is willing to take the guidance, which we are going to help the, in training, which we are going to help the parent, the family. So that's why this is very important. Then number 11, this is where we are going to select a job. So we are going to select the 3 jobs for that particular person with Down syndrome or any other associated condition, so that at least he is not suitable for first job, then we can move to the second job. But yes, you're going to write a reason why you are selecting that job. And number 11 is only written after you complete your generic skill assessment. Okay, so this is what we are going to do in the vocational profile. Okay, now when we come to the main part of your generic skill assessment, you can see in this you have a total 8 domains. Okay, and each domain has specific items which we are going to score against that. Let us say in personal you have 4. In the total area here, you can see, let us say out of 4, the child does independently only 3 items in that, or from personal it just only 3 you can. So you have to write 3. Or let us say he does work independently, only 2 items, so you can write 2. Similarly, in communication skills, you have total
five. So
5.
out
So
of
out of
five,
5,
how
how
many
many
items
items
does he
does he
does
does
independently?
independently?
So you
So
have
you
to
have to
write
write
4,
4,
3,
3,
2
2
as per
as
the
per the
observation,
observation,
as per
as
the
per the
interview,
interview,
as
as
per
per
your
your
assessment,
assessment,
you're
you're
going to
going to
write
write
down.
down.
Okay,
Okay.
so
So
similarly in
similarly in
social
social
behavior,
behavior,
and you can
and you
see
can
you
see you
have
have
here
here
tick.
ticked.
Okay,
Okay.
this
This
is the
is the
scoring
scoring
criteria. So
criteria.
if
So
it
if
does
it does
independently,
independently,
then you have
then
to
you have
tick,
to
and
tick,
then you
and then
have
you
to
have to
count
count
how many
how many
ticks. That
ticks. That
means
means
out of
out of
out of
out of
10, how
10,
many
how
child
many
has
child has
achieved.
achieved.
So that
So
is
that
very
is very
important.
important.
Similarly in
Similarly, in
functional
functional
academics, you
academics,
have
you have
30
30
items,
items,
and
and
safety
safety
skills,
skills,
domestic
domestic
skills,
skills,
mobility,
mobility,
occupational skills.
occupational
So
skills. So
total you
total
have
you have
8
8
domain, and
domain,
this is
and this
how
is
it
how
looks,
it
your
looks, your
progress of the
progress of the
child,
child,
progress of the
progress of the
person.
person.
So
So
similarly,
similarly,
as I
as I
said
said
above,
above,
personal has
personal has
4.
4.
So
So
against
against
4,
4,
how much
how
the
much the
child has
child has
achieved.
achieved.
Communication, how
Communication,
much the
how
child
much
has
child has
achieved. Out
achieved.
of
Out
10,
of
how
10,
much?
how
Out of
much? Out
30,
of
how
30,
much? Of
how much?
7.
Seven.
So
So
total
total
in this
in this
checklist we
checklist,
have
we have
80
80
domains. Out
domains.
of
Out of
80,
80,
it
it
might be, let
might
us
be,
say,
let us say,
40.
40.
So
So
40
40
out of
out of
80,
80.
that means
That means
50% the
50% the
child
child
has
has
achieved.
achieved.
So
So
50%
50%
we
we
need
need
to say
to
that
say that
child has
child has
achieved
achieved
50%,
50%,
and
and
still he
still he
requires a
requires a
training
training
before
before
we
we
push
push
them to
them
the
to the
occasional
occasional
phase or
phase or
occasional
occasional
training.
training.
This is the
This is the
first
first
stage in
stage in
occasional
occasional
phase
phase
what we
what
do.
we do.
Okay,
Okay.
so this
So
is
this is
just
just
overview
overview
of
of
occasional
occasional
assessment
assessment
or
or
functional
functional
assessment,
assessment,
or you
or
can
you can
say
say
programming
programming
assessment
assessment
for the
for the
adult
adult
person with
person with
Down
Down
syndrome or
syndrome or
intellectual
intellectual
disability,
disability,
because
because
vocational
vocational
process
process
remains the
remains the
same for
same
all
for all
disabilities.
disabilities.
Okay,
Okay.
now let
Now let
me
me
tell you
tell
what
you
are the
what are the
different
different
phases.
phases.
um,
Um,
Let me
let me
share
share
my.
my board. Yeah.
Let us
Let
come
us come
back and
back and
understand.
understand.
See, we have
See, we
seen
have
the
seen the
transition
transition
model,
model.
we have
We
seen
have
the
seen the
occasional
occasional
assessment.
assessment.
Now let us
Now let us
understand the
understand the
phases.
phases.
Vocational phase
Vocational
for
phase for
occasional
occasional
training.
training.
Now
Now
here,
here,
this is
this is
important.
important. You know,
Whatever we
whatever we
have
have
learned just
learned
now,
just now,
where we are
where we
going
are
to
going to
apply in
apply in
occasional
occasional
training.
training.
Let me
Let me
complete it
complete
here
it here
itself.
itself.
See,
See,
occasional
occasional
phases
phases
will have
will
a
have
three
a three
stages.
stages.
Okay,
Okay,
or you
or
can
you
say
can
three
say three
phases. So
phases. So
phase
phase
1,
one,
phase
phase
2,
two,
and
and
phase
phase
3.
three.
So in
In
phase
phase
1,
one,
just now
just
which
now
we
which
have
we have
seen,
seen
VAPS,
VAPS,
Vocational
Vocational
Assessment
Assessment
Programming
Programming
System,
System,
that
that
we
we
need
need
to
to
do in
do in
phase
phase
1.
one.
As I
As I
said,
said,
child has
child
just
has just
achieved
achieved
40%. If the
40%. If the
child
child
achieved
achieved
40%, that
40%,
means
that means
this is
this
not a
is not a
criteria
criteria
to push
to
the
push the
child
child
in the
in the
second
second
phase.
phase.
The
The
child must
child must
achieve
achieve
at least
at least
80%
80%
or
or
above
above
80%,
80%,
so that
so
we
that we
can
can
move
move
them to
them
the
to the
occasional
occasional
training.
training.
And this
And this
phase is
phase is
called
called
trade
trade
training.
training.
Trade
Trade
training. That
training. That
means
means
in this
in
we are
this we are
going to
going to
focus
focus
vocational. You
vocational. You
remember,
remember
we have
we have
selected a
selected a
three
three
job for the
job for the
child.
child.
One we are
One we
going
are
to
going to
select,
select,
and then
and
we are
then we are
going to
going to
draw a
draw a
task
task
analysis. We are
analysis. We are
going to
going to
chunk
chunk
those
those um,
the
the
job which we
job which
have
we have
selected.
selected.
We will
We
have a
will have a
different
different
step in
step
this.
in this.
Then we are
Then we are
going to
going to
train the
train the
child. Let us
child.
say
Let
the
us say the
child is,
child is,
for the
for
child,
the
the
child
job
the
is
job is
selected is
selected
like
is like
office boy.
office boy.
So what
So
are the
what are the
skills
skills
required
required
to
to
train
train
the
the
child?
child?
So
So
those
those
particular
particular
skills
skills
must be
must be
trained
trained
in
in
phase 2.
phase two.
Once
Once
the
the
child is
child is
trained, it
trained,
might
it
be for
might be for
6 months,
6
it
months,
might
it
be
might
for a
be for a
year,
year,
it
it
might be
might
for
be
more
for
than
more
one
than
year.
1 year.
So once
So
the
once the
child
child
achieve the
achieve the
80%,
80%,
once you
once
see
you
the
see the
child is
child is
independent in
independent
that
in that
particular
particular
job
job
or
or
trade,
trade,
then you are
then
going
you're
to
going to
push
push
to the
to the
phase
phase
3.
3.
And
And phase 3 is all about your placement again, where the child will be placed. That means here in the placement, child will be taught or polished the skills which he has taught. The resume will be prepared. The market survey will be done. The child will be placed and it will be followed up. Okay, so this is a simple way to understand about the vocational rehabilitation, which includes your medical, social education and occasional training. Okay, So this was overview of your occasional training program. This is how we are going to prepare the person, adult person with Down syndrome or any other developmental disability for occasional training. Okay, so that they can become independent and productive member of the society. Okay, so that's it about the occasional training. If any guys have any doubt, they can go ahead and can ask if they have any doubt of all three presentations. Thank you.
Thank you, sir.
Thank you, sir. Thank you, sir.
So if any questions you guys can ask,
Thank you, sir.
try to clarify, and then we'll end this.
So, what are the places we can place the child?
Okay. See, there are different places. As I said, there are open employment, like, if the child skills are matching, we can go ahead, identify the job at the shopping mall, at the petrol pumps, or at the metro stations. It depends. If the child is mild, quite mild, and has a good skills, we can place, and we can, then we can place the child anywhere, wherever there is a job. But the condition is the skills of job and the child skill must match. The person's skills and the job skill must match.
Thank you, sir.
Sir, hello, sir.
Yes,
I
yes.
have a one more doubt, sir. Now, occasional assessment as a special educator, we can do the occasional assessment for the child, or is any person to assess the child?
See, if you can do, because as you in your, even in your curriculum you have. So, but if you have a vocational degree, that will be more valid, because they will be taught in detail what kind of um, you know vocational skills we need to take and assess. But as special educator, I think you can assess, no issues with that.
So, what are the checklists, sir, we have to go through the occasional assessment test?
You have a VAPS, Vocational Assessment Programming System. You have work behavior assessments. You have self-determination checklists. Then you have the different trade assessment checklist, which is specially designed by ministry also. That is your skill SCPWD, Skill Council for Person with Disability. Till date, they have developed 4,000 plus curriculum for all the disabilities. Okay, so as per the SCPWD, our ministry, the time frame is 6 months.
Okay, okay, sir. Thank you, sir.
Okay. Anything else?
Sir,
Yeah.
this is Uma, sir. Is there any centers for Down syndromes in Hyderabad, sir?
As I said, Down syndrome, autism, we have different special schools for intellectual. This is an associated condition, right? So specifically, we have different associations, organizations, even all over India. Whereas in Hyderabad, I need to just find out.
Okay, sir. Okay, sir.
Anything else? Okay, anybody have any doubt? If not, then we will shift this meeting.
Thank you so much, sir. On the Autism Day, you have selected this
It's not autism,
program to
Down.
conduct and to give the valuable information to
It's
everybody. Thank you so much, sir.
Down syndrome week, actually. October is the Down syndrome month. I mean to say awareness month. Okay.
Okay, sir.
Okay then. Thank you.
Thank you, sir.
Sir,
Thank you so
thank you so
much.
much.
Thank